So lots of people ask me how blood pressure works, so, down to the fact of the machine that we put on. So if you look at, let's look at you. Here is your arm, and doctors, or nurses put a blood pressure cuff around your arm. Okay, and if we look at your heart, is here, and a big pipe comes out the top, and then there's a blood vessel. They go everywhere, but there's one that goes down into your arm on the inside down here. And so what happens is when that blood pressure cuff is pumped up, it squeezes this blood vessel. So let's have a look at you, like we've chopped through your arm there and down here. So here is your blood pressure cuff and your arm on the inside, and in here is your little artery. All right. So when this blood pressure cuff gets pumped up and gets bigger and bigger and bigger, it squeezes your arm and squeezes this blood vessel because it's squishy until it's closed up completely. And so when we start to let the pressure down and this comes down, your artery slowly opens up until it's at the size it normally is. So your blood pressure, your heart will pump blood out, and it's a small volume. So you have 5.5 litres approximately of blood in your system, and your heart pumps about 300 or 400 mils out into your whole body. And so that sends like a pulse wave. It's sort of like, I describe it like you've dropped a stone into a pool and there's a ripple. So when you feel your pulse down here at your wrist and your arm, that's that pulse wave going through from when your heart has squeezed. So that is what we call your systolic pressure, and that's when your heart squeezes, okay? So when we tighten this up so the artery's squished, we put our stethoscope on here and we can't hear anything. So there's your stethoscope, and you can't hear anything because you can't hear, you don't have a pulse coming through here at all because it's squished. As we release the pressure and the artery opens up just a little bit, it's like you're forcing a little bit of blood through a really tight tube, and you can hear it go through each time your heart squeezes. So you hear a whoosh noise come through, and that's what the doctors are listening to here at your arm, because they can hear that pulse come through. And then as you release the pressure, eventually we get down to when the artery's open all the time, and then there won't be any noise anymore because the artery's not tight. And so and that's the pressure that your heart is relaxed at. So that's called your diastolic, and that is when your heart is relaxed, waiting for the next lot of blood to come into it so it can squeeze another lot out, okay? So your systolic pressure is when your heart squeezes, and your diastolic is when your heart relaxes. And so in the whole process of your heart squeezing and your heart relaxing and letting the blood flow through, this part takes up about 1/3 of that whole cycle. So of the time of that cycle, is a third is in the systolic time, and then for your diastolic it's about 2/3. So if you think about a whole day, your heart squeezes for 1/3 of your day effectively and is relaxed for 2/3 of the time. So then if we talk about numbers, so you know when your doctor does, or your nurse does this, you've got a dial on the desk and it's got numbers all on it, and with 0 at the bottom, and then maybe about 160s up here near the top somewhere. And we've got 100, let's put in 120 and 80. Okay, so for my patients, I'll squeeze up the blood pressure cuff until that needle points up to about 160. I know it's not very comfortable. And then we let that pressure off the cuff come down slowly, and as it comes down, we will start to hear that pulse I talked about coming in, and so hopefully that's around the 120, and that's the pressure your heart's squeezing at, so that's that top number. And then you may be able to feel it as it goes along down here. You can feel the pulse in your arm until you can't feel it anymore, and that's when your arteries fully open and your heart is at its relaxed state, and so that is the lowest blood pressure. So let's put that in 80. Okay, and then we just let it down completely. So normally I can hear a pulse starting at that top number, and it will go like your pulse normally does right down until the bottom number is reached, and that's how we work out what your blood pressure is. Okay, what we like to see is that this top number needs to be less than 140, and even some people talk about 130. If you think about your ideal blood pressure, it should be around this number or less, okay? And then the bottom number should be less than 90, okay? And so when your blood pressure is high, it causes harm in your blood vessels. And so if this top number is high, that pulse pressure is really strong and can cause harm. And if your bottom number is high, then that pressure that's in there all the time can cause harm. So whatever number you have that's high, whether it's the top one or the bottom one, they can both cause trouble.